Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today's episode is about another important over-the-counter medication I would like to introduce before spring allergy season arrives. If you or someone you care about struggles with seasonal or year-round allergies, this is a medication that may be helpful, especially if you have not tried it before. That medication is Flonase, one of the effective and most commonly used over-the-counter nasal sprays for allergy symptoms. Many of my patients tell me they have only used it briefly or have not used it at all. I also see a lot of confusion between Flonase and Flonase Sensimist. Although the names sound similar, they are actually two different nasal sprays. Flonase contains fluticasone propionate, while Flonase Sensimist contains fluticasone furoate. Both are corticosteroids and share the same core structure, but they differ in their chemical side chains and do not share common drug metabolites, which can influence how they behave in the nose. In today's episode, I will focus specifically on Flonase. In this video, I will walk you through 5 key things you need to know about Flonase, its indication, how it works, how to use it correctly, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Flonase and who it's for? Flonase is a nasal spray that contains fluticasone propionate, a corticosteroid. The over-the-counter formulation is approved to temporarily relieve symptoms caused by hay fever or other upper respiratory allergies, including runny nose, nasal congestion, itchy nose, sneezing, and itchy or watery eyes in adults and children 4 years of age and older. Flonase has a long regulatory history. Its prescription version was first approved by the FDA in October 1994. And in July 2014, the same active ingredient and strength became available over the counter, improving access without the need for a prescription. Flonase can be used for both short-term seasonal pollen allergies and ongoing year-round allergies caused by dust mites or pet dander. For patients whose nasal symptoms are not well controlled with oral antihistamines, Flonase is often a reasonable next option to consider. Second, how does Flonase work? The active ingredient in Flonase, fluticasone propionate, is a corticosteroid with broad anti-inflammatory activity. It suppresses multiple immune cells and inflammatory mediators, helping to reduce swelling and mucus production. By acting directly on the nasal mucosa, fluticasone propionate targets the underlying inflammation that drives allergic rhinitis. Patients may begin to feel relief within 24 hours after use, but the maximum benefit may take several days of regular once daily use. Third, let's talk about how to use Flonase. Flonase is for use in the nose only and should not be sprayed into the eyes or mouth. Each spray delivers 15 micrograms of fluticasone propionate. For adults and children 12 years of age and older, the recommended starting dose is 2 sprays in each nostril once daily for the first week. From week 2 through up to 6 months, the dose can be adjusted to 1 or 2 sprays in each nostril once daily, as needed to treat symptoms. After 6 months of daily use, patients should ask a doctor if continued use is appropriate. For children 4 to 11 years of age, the recommended dose is 1 spray in each nostril once daily, with adult supervision. If a dose is missed, simply resume the regular dose the next day. Do not add an extra dose to make up for it. Before first use, gently shake the bottle and prime it by pumping until a fine mist appears. If Flonase has not been used for 7 days or longer, it should be reprimed before use. Detailed step-by-step instructions are provided in the package insert, but here are several key points. Before each dose, gently blow the nose to clear the nostrils and always shake the bottle, since Flonase is a suspension and needs to be well mixed. Place the nozzle tip into one nostril, close the other nostril with the finger. While sniffing gently, press down on the spray nozzle. You should feel a light mist in the nose and then breathe out through the mouth. Avoid spraying directly on the nasal septum, the central wall between the two nostrils, which contains many blood vessels and limited nasal tissue. Spraying directly on the septum may increase the risk of nosebleeds without improving symptoms. Caution is advised when using Flonase with strong CYP3A4 inhibitors, such as certain antifungal medications or HIV treatments, as these drugs may increase systemic exposure to fluticasone propionate. Reviewing all medications and supplements with the doctor or pharmacist is always a good practice to screen for potential interactions. Fourth, let's review the warnings and precautions. Hypersensitivity reactions have been reported with Flonase use and may cause anaphylaxis, hives, rash, breathing problems, and swelling of the face, mouth, or tongue. If this occurs, stop Flonase and seek medical attention right away. Local nasal adverse events may develop, including irritation, nosebleeds, nasal ulcers, and in rare cases, nasal septal perforation, a hole in the cartilage between the nostrils. These risks are known with intranasal corticosteroids. For patients using Flonase for several months or longer, periodic examination of the nasal lining is recommended. Because corticosteroids can delay wound healing, patients with recent nasal ulcer, nasal surgery, or nasal trauma should avoid using Flonase until healing has occurred. Localized fungal infections, such as Candida in the nose or throat, have been reported with intranasal fluticasone propionate. Patients should contact a healthcare provider if they notice redness or wet patches in the nose or mouth. If such an infection happens, treatment may include antifungal therapy and stopping Flonase. Because Flonase contains a corticosteroid, it may affect immune system and increase susceptibility to infections. While using Flonase, patients should avoid exposure to contagious illnesses such as tuberculosis, chickenpox, or measles. If you have or had any of these infections, or have relevant travel or exposure history, stop Flonase and discuss with your doctor. Using Flonase at higher than recommended doses or together with other steroid medications for asthma, allergies, or skin condition may increase the risk of systemic corticosteroid effects, including hypercorticism and adrenal suppression. Ask a doctor or pharmacist before using Flonase if you're taking other steroid medications. Corticosteroids may also contribute to the development or worsening of glaucoma and cataracts. Patients with a history of blurred vision, elevated eye pressure, glaucoma, cataracts should talk to a doctor before using Flonase. Any new vision symptoms should be evaluated promptly. In children, corticosteroids may slow growth. Pediatric patients should use Flonase for the shortest duration necessary to achieve symptom relief. If a child needs to use Flonase for more than 2 months per year, this should be discussed with a healthcare provider, and growth should be monitored for prolonged use. And finally, let's talk about the side effects and safety. In clinical trials of the prescription formulation involving patients 4 years and older with allergic rhinitis, the most commonly reported side effects included headache, sore throat, nosebleeds, nose burning or itching, nausea and vomiting, trouble breathing, and cough. Many of these occurred at rates similar to placebo. Nosebleeds were reported more frequently in patients using Flonase than those receiving placebo. If you experience frequent or severe nosebleeds, stop using Flonase and consult a doctor. If symptoms do not improve within 7 days of starting treatment, or if new symptoms such as severe facial pain or thick nasal discharge develop, this may suggest something other than allergies, such as an infection. In that case, stop Flonase and seek medical evaluation. Overall, when used as directed, Flonase has a well-established safety profile. And there you have it, 5 key things to know about Flonase, a once daily, over-the-counter nasal steroid that provides targeted relief for allergy-related nose and eye symptoms. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experiences in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.